Assalamualaikum everyone. I hope you all are doing good. Uh, आज आपको जितना पता है basically today is World Hepatitis Day and it's 20th July. So today's our special webinar topic is on hepatitis and oral health and we'll be discussing about it. It's basically a connection every dentist will know. So without any delay, let's start. This is a bit of introduction about me. My name is Dr. Mohammed Farooq and I'm founder of Pride as well as Experience Industry. Alhamdulillah, I have around 38 plus publications in IM, out of which 5 are published in international journals. I am running my own clinical practice with the name of Dr. Farooq Dental Clinic. So what is for introduction about me? तो आज की बेसिकली सेशन के ऑब्जेक्टिव क्या हैं? हम अंडरस्टैंड करेंगे डिफरेंट टाइप्स ऑफ वायरल हेपेटाइटिस रेलिवेंट टू डेंटिस्ट्री, रिकॉग्नाइज करेंगे ओरल मैनिफेस्टेशंस ऑफ हेपेटाइटिस को, मैनेज करेंगे हेपेटाइटिस के पेशेंट्स को सेफ्टी नेगेटिव प्रैक्टिस, प्रिवेंट करेंगे ऑक्यूपेशन एक्सपोजर जिस वजह से हो सकता है हेपेटाइटिस बी और सी, हैंडल करेंगे नीडल स्टिक इंजरी जो कि जिसके थ्रू बहुत मोस्ट कॉमनली ये स्प्रेड होता है मोरल ट्रांसमिशन, ठीक है, एंड काउंसिल करेंगे पेशेंट को रिगार्डिंग ओरल एंड सिस्टमैटिक हेल्थ के वाले से और अप्लाई करेंगे एविडेंस बेस्ड इन्फेक्शन कंट्रोल को. So let's start. Before starting, just imagine this scenario. You are basically performing a routine extraction, dental extraction. Halfway through, the patient suddenly says, "Doctor, I forgot to tell you, I have hepatitis B." Oh, what would you do in this case? Now, in this scenario, would you continue doing dental extraction, or would you stop? Would you panic? Would you refer it to another dental practitioner or someone else? This basically webinar answers exactly these questions. Okay, so let's walk through it. Why should dentists care? Dentists को basically care क्यों करना चाहिए regarding hepatitis? Globally, कह लें more than 300 million people जो हैं वो रह रहे हैं, live कर रहे हैं with chronic viral hepatitis. Many patients are unaware that they are infected. Hepatitis B and C are sometimes they don't present with symptoms. So most of the people don't know that they are living with hepatitis B or C. Okay, dentists are among healthcare workers at the highest occupational risk. Basically, we are the front line people who get exposure with these people because of why? Because we can get exposure with their blood. We can we have sharp instruments that can get our needed injuries. We do aerosols, as you all know that the air rotor we use and the hankies we use, it generates aerosol when cutting around and other things. And then the patient's saliva is also a contamination thing. So patient blood and saliva can be the major cause of spreading it. What is hepatitis? So basically hepatitis is inflammation of the liver. In one line or one definition, if you say, most common infectious causes include hepatitis A, B, C, D, and E. These are all the types of hepatitis that a patient can get. Dentists basically mainly deal with hepatitis B and C more commonly. In our clinical practice, we get encountered with these more commonly. Why focus on hepatitis B virus and hepatitis C virus, HCV and HCV? Because both can become chronic, and when they become chronic, they can cause cirrhosis, liver cirrhosis, and ultimately it can lead to liver failure, and it may also cause liver cancer as well. So the patient may appear completely healthy, may don't know that they are infected, because in their cases the symptoms may not appear, but they might have hepatitis B and C virus, which may ultimately lead to cirrhosis and liver failure if not treated timely, if not diagnosed timely. So modes of transmission include hepatitis B virus include blood. Patient blood can be the cause of getting exposure to hepatitis B virus. Patient saliva can cause hepatitis B virus. Needles can usually play a major role in it. Sexual contact, this also plays a role in transmission of hepatitis B virus, and mother to child. So this may also lead to during a delivery may also lead to the disease transmission of hepatitis B virus. If we talk about hepatitis C virus, what are the modes of transmission about it? Mostly blood, IV drug use, intravenous needle stick injury, it may also lead to it, and blood transfusion in the older cases. Rarely, hepatitis C virus occurs through the saliva, so you should know that about it. Okay, why dentists are at risk? Every day, dentists are exposed to the patient's contaminated blood, patient contaminated saliva, needles, which may lead to needle injury, unintentional surgical plates that used in our surgeries, ultrasonic aerosols that are basically generated during scaling and polishing and crown cutting, you all know. bone particle when you are basically cutting the bone as well. And one accident injury may change a life. If a dentist gets a needle injury, he or she may also get hepatitis B or C virus because of it. So first, let's discuss about a real life story. One, a young dentist was placing sutures after a section. While recapping the needle, it pierced her finger. The patient later disclosed being hepatitis B positive. Fortunately, the dentist had completed HBV vaccination. That was a good thing. Anti-HBs titer was more than 100 ml per unit per ml, so that was good thing. The doctor the dentist didn't need a booster dose of hepatitis B vaccination. No infection occurred in this scenario. The lesson was vaccination saved her career. Otherwise, the doctor might have also gotten the hepatitis B virus. So vaccination does a very important role. That's why all healthcare professionals should get hepatitis B and hepatitis B vaccination before entering in the field of healthcare, because you can get hepatitis B virus potentially or unintentionally from the patient not knowing. Occupational risk, average risk after the needle stick injury of getting hepatitis B virus is around 6 to 30%. About hepatitis B virus is less than 2%, and HIV is around 0.3%. The hepatitis B virus is most infectious than the HIV. You should know that. What are the basically clinical features of hepatitis? Many patients have no symptoms, as I said. Others may complain of fatigue, fever, nausea, weight loss, yellow eyes, dark color urine. Dentists may be the first healthcare professional to suspect liver disease. So we play a very important role in diagnosing it as well. So what are the oral manifestations? Oral manifestations may include jaundice, oral mucosa. You may see oral mucosa of yellow color, petechiae, gingival bleeding, delayed healing in these patients, oral ulcers, xerostomia, dry mouth, lichen planus, especially hepatitis in the hepatitis C patient. You may see the lichen planus as well, taste disturbances as well reported by the patient. In lichen planus, you can see that the important position with hepatitis C in the hepatitis C patient. The clinical appearance may look like white lace-like lesions, burning sensation, pain during eating. Patient will tell you that I have a lot of pain when I do eat. Then they should think beyond the mouth. Okay, so they may relate to the systematic disease condition as well, not just an oral condition, and not confuse it with burning mouth syndrome. Okay, real life case two: a 48-year-old female repeatedly treated for burning mouth. The patient keeps on telling you that I have burning mouth, it doesn't resolve. You diagnose it as an oral lichen planus. Dermatologist suggested hepatitis training. In this case, he tested positive for hepatitis C. So dental examination becomes the first clue in this scenario. Okay, so bleeding pregnancy, we talk about bleeding pregnancy. Liver produces, as you all know, that liver produces clotting factors. Severe liver disease causes easy bruising of the gums and gingiva. You can see a lot of excessive bleeding from the gums, delayed clot formation. Always success in this case, INR, international ratio, okay, and platelet count, and also take patient medical history as well. Before dental treatment, always ask, have you ever had hepatitis to the patient. अगर आप पाकिस्तान से हैं साउथ एशियन कंट्री से हैं यू कैन आस्क आपको काला पीला कान तो नहीं हुआ कभी जिंदगी में ठीक है दे विल टेल यू ठीक है ठीक है आप बताएं लिवर डिजीज आपको कोई जिगर का मसला तो नहीं है हैव यू एनी लिवर डिजीज आपको जॉन्डिस तो नहीं है ठीक है तो इसी तरह से आप पूछ सकते हैं ब्लड ट्रांसफ्यूजन डायलिसिस आईवी ड्रग यूज तो नहीं करते ठीक है नेवर जज पेशेंट दिस इज नॉट अवर थिंग वी शुड जज पेशेंट वी शुड जस्ट आस्क देम एज अ हेल्थ केयर प्रोफेशनल about their history. Ask them respectfully. This is the main important thing here. Okay, scenario is a patient says, I had hepatitis 15 years ago, but I am fine now. Should the treatment be stopped? No. Ask which hepatitis did you got 15 years ago? Which type basically? A, B, C, D. Okay. Are you on any current medication? Do you know their names? Do please tell us. Have you any recent liver function test done? Please tell us. Physician clearance if needed. In such scenario, you can ask them to consult their doctors and get their recent LFT done and hepatitis B and hepatitis C virus screening done and let you know if you are doubtful. Okay. Laboratory tests that are useful for you would be useful LFTs, liver function test, INR for platelet for clotting factors, platelet. You can do a platelet test, SVSAV, and the HCV basically for in the case of hepatitis C virus only when medically indicated. Then you will write these tests. Okay. Is routine dental treatment safe in the hepatitis patient? Yes. If universal precautions are followed, then yes. No discrimination to the patient who has hepatitis from the normal patient. We should not do this thing. And no refusal. But I do see some people do refuse them on their basis because of discrimination that you have hepatitis, we will not treat you. So this is not an professional way or ethical way of dealing with the patient. We should not discriminate. Uh, for all of the patients are equal for us. Either they have hepatitis or not. Treat every patient as potential infectious. When I was in my undergrad level, my teachers used to say treat all the patients as their the saliva and blood is contaminated when we used to do scaling rotation. So this is the very important thing. You don't know. Patient might not disclose you in your history that they are getting, they have hepatitis B. Sometimes, as I said, they don't know. They are not familiar of the symptoms as the symptoms don't appear. So you should take extra precautionary measures on every patient. Okay. What are the universal precautions? Assume that every patient is basically a carrier. He is having hepatitis B virus every time. In every procedure, you have to take precautions. May carry infectious diseases. Okay, so in this, you have to take these universal precautions. You have to wear safety goggles, all your PPE, personal protective equipment, take a mask, safety shields. So what does come under the personal protective equipment? They have essentials include gloves, face shield, surgical mask, protective eye gear, gown, and double gloves for surgery if desired. Okay. Uh, Instrument sterilization, this plays a very important role. The instrument should be sterilized with autoclaving and chemical indicators must be neat. Biological monitoring should be done and proper packaging should be done. Sterilization should be never compromised. Okay. Real life story 3, a clinic reused hand pieces without proper sterilization between the patients. Months later, multiple infections were investigated. One mistake damaged the clinic's reputation. Sterilization protects everyone. Unfortunately, what I do see is in the hospital, this procedure is basically repeated. I do see because of the shortage, I think the shortage of money or not having a lot of resources, a single hand piece is used on the multiple patient in a one day. And just what they do, a little bit disinfectant on the hand piece. This doesn't equally basically kills all the bacteria. As you know, that spores are not degraded unless you do a sterilization. So sterilization is must. Try to use a single handpiece on single patient and change in between multiple different patients. Okay. One time it may cost you, but if you have around 2 or 3 hand pieces, it may save other people lives as well. They might don't get any other disease, and your clinic reputation, hospital reputation will also be safe. Dental procedures that are usually safe are scaling, extraction, root canal treatment in hepatitis, CCAS, implant, provided, but a proper medical assessment is done, proper infection control is done, grading precaution have been taken. Because you need to take all these things in mind when performing these procedures. Drug considerations, avoid excessive taking of paracetamol. And fifth, as you all know that paracetamol and NSAID go to the first pass metabolism from the liver. They are basically detoxified in the liver and they will ultimately damage the liver if the liver is already damaged. So it will ultimately lead to the cirrhosis of the liver and may cause liver failure as well. Certain antibiotics, patient with advanced liver disease may require dose modification. So some patients may come to you and say, I have stage 2 or stage 3 liver disease, like liver fibrosis or liver cirrhosis. In those scenarios, you have to be considered when prescribing any kind of painkiller or medicine because the first pass metabolism is always to the liver. In such patient, you can't basically prescribe NSAID blindly. Okay, so you need to take a lot of consider regarding their dosage and these as well. Consult physician in these cases. Okay, what if needle stick injury happens? This is a very important thing, and this most commonly occurs in hospitals and clinical setting as well. First you need to do is stay calm. Okay, wash with the soap. Don't squeeze aggressively. Okay, report immediately to the hospital or if you are in a clinic to your staff. Assess the patient, assess the vaccination, and seek the medical care if required. Okay? Consider PET if indicated. You need to take prophylactic course of basically hepatitis B or C virus. Okay? In this scenario as well, if you are not confirmed and the patient is not confirmed as well, until basically the reports came and your vaccination status is also not good. So in this scenario, you have to take it. Scenario assistant accidentally received needle stick. Patient known hepatitis B positive. Vaccination status unknown. What should happen first? What we should do in this scenario? You should immediately watch, report it. Hepatitis B virus testing to be done, and then the vaccination to be done. If not, first was done, and hepatitis immunoglobulin should be indicated in this scenario as well. Hepatitis B vaccination, every dentist should be vaccinated. I will say every healthcare professional. Get your staff vaccinated as well, hepatitis B virus. If you he is a dental hygienist, dental technician who is basically accompanying you in the daily procedures, they should also get hepatitis B vaccination. Okay? Check antibody titers after an year or 6 months if you are doubtful that if a booster dose is required or not. Booster dose should be done if recommended. Vaccination is prevention, not the treatment. Okay? Vaccination will prevent you from getting hepatitis B virus, but it is not the treatment. Ethical responsibility is never refuse the treatment. Don't refuse the treatment of hepatitis B or C virus. Don't discriminate them. Never disclose the patient diagnosis. This is also a confidentiality for you. Maintain the confidentiality of the patient. Provide equal care as you provide to your normal patient. Real life case 4 is a patient was refused extraction by 3 clinics after receiving hepatitis B. So he developed severe facial swelling. Eventually treated stably at a hospital. Disease was not the problem, fear was. So all the 3 clinics were not afraid of that patient had facial swelling, but they were afraid that patient had hepatitis. So they were afraid that they might get hepatitis as well. So patient education, advise patients maintain oral hygiene. Regular dental visits should be done. Of these patients, avoid alcohol. Ask them not to intake alcohol intake. Medication compliance should be done in this case. Medical follow-up should be done. Vaccination for all the family members of hepatitis B virus. We should also educate them. Okay. Case discussion is a 52-year-old male needs extraction. Known hepatitis C case. Platelet normal. INR normal. Liver stable. Can extraction be performed in this case? Yes. If the platelets are normal, INR is normal, liver is stable, yes. So why not? Okay. But use standard precaution in this scenario. Case discussion 2 is a 60-year-old cirrhotic patient. The patient liver is in the liver cirrhosis stage. Okay. The person needs multiple extraction and INR is 3.5, platelet is 45,000. What would be the management in this case? You will delay the elective surgery, physician consultation will be done, correct coagulopathy would be done, and hospital setting if needed. Okay. So let's discuss a little bit some myths and facts. Myth is basically hepatitis patient cannot receive dental treatment. Fact is they can receive treatment. Okay. So this was a myth. Myth is double glove eliminate infection. Fact, good infection control is more important. Okay. The myth is healthy looking patients are infection free. Fact, many hepatitis patients have no symptoms. As I told, most of the patients having hepatitis B and C don't have any kind of symptoms. So you don't know are they carrier or not. Okay. So future of dentistry would be rapid diagnostics, safer sterilization, digital records to be maintained, AI-assisted assessment would be done, vaccinated workforce would be available. So take-home messages for today are hepatitis is common. Dentists may detect first signs. Oral lane can indicate liver disease. Universal precaution protect everyone. Vaccination is essential. Never discriminate against patients. Safer dentistry, ethical dentistry. So closing quote for the today is treat every patient with compassion, every instrument with caution, every procedure with excellence. So this is the quote for today, and I hope this session was very fruitful for you guys. Again, thank you very much for being here. This is today World Hepatitis Day. a reminder for all of us to take extra precautionary measures for the patients living with hepatitis and to basically also educate the people around us about it as a health professional as well. Uh, okay, thank you. If you have any questions, please feel free to ask in the chat box. Your certificates will be issued in a while. You will get them through the email. A link will be shared of Google Drive. You can download them from there. Okay. I guess there is no question then. Thank you very much again for being here. Allah Hafiz.